lifting weight or bending down was like, is it okay, ma'am, to really do that? That was the first question always they ask, right, during prenatal fitness.
When can a pregnant mother actually start working out? When are they not supposed to be doing fitness?
Importance of being healthy during pregnancy, which can lead to a very healthy postpartum phase as well. It's just not about mothers, I would say. It's also about partner support, what they have gotten during labor and pregnancy. So the journey from pregnancy to parenting is not very simple and not very complex. Also, it's a balance of both, I would say. Most of the mothers, 80% of the moms come back and talk about like, I'm suffering from lack of milk. My baby is not able to latch the nipple. So lifting buckets is quite different from lifting dumbbells. Optimal nutrition and the right nutrition plays a very, very big role in the health of the pregnancy. And also the postpartum recovery, right? What you eat also during pregnancy. Breastfeeding works in demand and supply process. Like the more you breastfeed, the supply also comes in a similar way, which means the baby has to suck the breast more for the production to happen more, right? Fear of going through longest labor is also one of the fears today most of the mothers go through. For the marriages, we don't give that voice to somebody else. For the births, we should not be giving it, but rather you should be discussing it. Okay, according to WHO, the stats today of the C-section, which is again the cesarean, is 10 to 15% is something where every country like has to really respect. But today, India is standing at 21.5, which is again a little bit of alarming figure, I would say.
While we were growing up, I've had my grandmothers speaking to my aunts or my elderly cousins, not to involve themselves in regular household work, rest as much as possible. Does that hold good? I mean, does that mean that they were actually wrong? Because whatever you just said.
I would say no, they were not wrong. It's just the timing and the context.
Right.
Back then, I guess, the education was quite less with regards to the movement. But now there is a lot of education towards being fit, right? The second aspect of it is also during our grandfather or grandmother days or, in-laws time. So they had access to what is the basic household chores, movement, through cooking, cleaning, or, the farming or the gardening. So those activities kind of made them feel very healthy. But they also kind of like, lack that education of being healthy and fit again. But at the same time, the lifestyle what we have today is quite changed, right? They did not have a sedentary lifestyle. Today we have a typical sedentary lifestyle for all of us because we are mostly on the laptops today. And also the watching the TV, as in like, sitting on the sofa for longer. So the body moves less here, and we are more towards sitting and more towards engaging our body in one place rather than the movement. So yes, they were not wrong, but at the same time, it comes out of concern when they say like rest during pregnancy and don't do anything. But it is also for the moms to give them assurance that, the gentle stretches are far better for the body because our lifestyle is changing. The context, the education, what they had, lack of education, because back then we did not have any, the gynecologist or the caregiver saying like, hey, come on, you need to go for a prenatal yoga classes or a prenatal fitness classes.
So today that's changed?
Today, yes. I see I would say a very minimal change happening, but I'm still very happy and proud about it. When the caregivers come and talk about like, having a healthy weight for mom is also good for the healthy birth weight baby as well. So yes, the time has changed and things are also changing. The lifestyle has changed. They were in a very healthy lifestyle earlier, but right now we are moving towards a little unhealthy, which we can really bring a positive.
This is one of those myths that Aura has broken.
Oh, yes.
Busted. Like I was saying, my grandmother had once had a very intense session with one of my aunts about not lifting buckets of waters while she was pregnant. So that's okay, right? I mean,
I would say it's still not okay because she was right. The grandmother was
which
right.
means okay.
I would say lifting a bucket is not really recommended for, as in like lifting a very heavy bucket, right? Because there is a spinal curve which has already happened because of the pregnant weight, the pregnancy weight. The second aspect of that is like, the body posture has completely changed. It has moved more forward, like, tilted more forward, and there is an arch in the back. Now, what happens there when there is an arch in the back, the deeper again, it kind of leads to what? Falls again. So that's one of the reasons the grandmother, grandfather, they say, do not lift the buckets.
So buckets, you spoke about lifting buckets, so which means that lifting dumbbells is no when you're pregnant, right?
All right. So lifting buckets is quite different from lifting dumbbells, because lifting bucket is very simple. When you talk about lifting bucket, it's like you are handling from one arm, right? But lifting dumbbells is more on the control movement. But the bucket is more on the uncontrolled movement. So if you're lifting, like one part of your body is actually bending just one side. So obviously that is unnecessary pressure on your spine as well as one side of the body. So that's again like, two different things. That's why lifting dumbbells, which has more control weight, where you are balancing your complete body, left and right, and of course,
lifting weights are okay then.
Lifting weights completely okay, but at the same time, it should not become overwhelming for a lot of moms. At the same time, it's not about in layman's term, I would say it's not about proving anybody. Like, your body can do a lot, but at the same time, making sure that you be a little gentle with the body, with the right guidance, as I said, earlier, and keep listening to the body as well. So lifting dumbbells, if you have come from a very athletic background, and that would also give an edge to your body to have that muscle memory. And that becomes a little easier for those kind of moms. But at the same time, when you're starting your prenatal fitness for the first time, and that way I would say you take it a little easier with the body, and always listen to your body, listen to the supervisor, like those who are doing it with you, take the guidance accordingly. So yes.
So this busts some myths that I thought I had in my mind. So some questions I have. I mean, you can throw some light on whether they're actually myths or they're actually the truth. Should a pregnant mother be eating for two people? Because
it's one of the biggest myths in India. I would say it is also coming out of concern and love and protection from the family, which is very loving, I would say, because we should be considered lucky as well. But at the same time, I would say again, eating for two is not really right, because it's more about eating for two in a very nutritious way, not on the quantity. So quality over quantity. That is very, very vital. So you cannot really, give a lot to the body when the body cannot really take it. So that leads to higher weight again in the pregnancy, which is again very unhealthy for the labor and the birthing time. Healthy birth weight is very, very important to maintain, because it kind of reduces your gestational diabetes, high obesity again in so gestational diabetes is basically the disorder, again the higher glucose level in the blood, which leads to again the diabetes. So imagine a mother never had diabetes in the family, but then she is suffering from GD again, right? So the fact is, what can really help the moms today is to ensure that they eat right, eat a good food. When I say good food, is more on the nutritional aspect, like complex carbs again, good fats like the walnuts, the dry fruits. These are again the good fats. Protein level again should be increased, which is, I think it's a way too common right now. People do talk about increase the protein, but at the same time, it should not go beyond as well. Having the optimal nutrition for both mother and baby helps a lot. But eating for two on the quantity wise, it's not really great.
So are there tests to help pregnant women understand, you know,
The
what did you say?
GD?
Yes.
Yes, they go through. Every mom today, most of the caregiver are doing the blood test today because to avoid and to surpass this GD, because mothers are getting it. So
So that's
yes,
something that you would advise all mothers to
I
get
would.
tested
I
on
would say
during
I will not
pregnancy.
advise, but at the same time, the caregivers list itself will say yes.
Interesting. So we touched upon food. I mean, how important you of course you spoke about how important food is. Are there some advices to give in terms of when you said eat right? What is eat right? Because there are some like myself who's a habitual eater. So would that mean that there has to be control on your diet? Even when I mean, of course, eating right is very important for everyone, but does it prove to be good for mothers to follow a particular diet? So is diet plan an important part during pregnancy?
I would say yes. You're very right. Thanks for bringing that question also. Optimal nutrition and the right nutrition plays a very, very big role in the health of the pregnancy and also the postpartum recovery, right? What you eat also during pregnancy, it leads to high, the good birth weight of the baby as well as the healthy postpartum recovery as well. But the portion control again, which is again important. We are not saying you have to starve, but ensure that you eat right. Eat right also means like frequent snacks again during pregnancy. Rather than having these 3 meals in a day, you have like short meal, the short snacks again. The first meal again, the breakfast, and then after that you see what can be eaten. Probably like the protein again, like eggs. Then post that the lunch again with healthy salads, a lot of protein, um, complex carbs again, which will not spike up your glucose level again, which can again help in terms of balancing. Post that again, the evening snacks again in a shot. So this way, what is happening? The body is not taking a lot at one go. Your sugar level is not going to spike up so quickly, right? It's going to get balanced. So that's why we say have short, frequent meals rather than 3 big meals in a day. And that is again healthy eating.
Moving back to myths, another question that comes to mind is: are cravings something that mothers uh, suddenly, get during pregnancy? I mean, like for example, something that you hated to eat or hated the smell of while you were not pregnant suddenly becomes a craving for you. Is that a myth or is it?
It is. I would say it's a very thin line there. I would talk about my experience. I used to love seafood, and I still love seafoods. But during my pregnancy, what really happened? I started to have that aversion towards seafood. The smell of it, I really did not like it. So it is happening because your body is changing due to the hormones again, right? So the pregnancy hormones which are there in the body, and that is leading up to these kind of aversions and the craving. Now, when the cravings are there in the body, like example, a couple of mothers do ask for like the chocolates or the ice cream, which is completely fine, once or twice here and there.
Control it.
Yes, but not like multiple times because you're gonna again increase your weight, which is again not healthy. And also when there is a lot of frequent cravings which are happening, you have to ensure that you get your blood test also done and speak to the caregiver because they would be the right person to give you the advice for the test, right? It could be because of the lack of iron. Maybe you have to work on the iron supplements what the caregiver is giving. So iron deficiency, calcium deficiency, you have to work on the deficiency also. And that's one of the reasons you need to become very serious about the prenatal vitamins, what your doctors give you, right? So take it more regularly. Do not miss that because that is again a healthy pregnancy criteria.
So diet and fitness go, I mean, of course, they go hand in hand.
Yes.
But when you throw in these kind of aversions into the picture, does that make the life of a pregnant woman extremely challenging or difficult?
I would say little challenging, not extremely, because few moms wanted to eat few things, but it is not right now happening. But they also need to understand it, just for the time being, things will get better sooner. But as I said, like, listen to the body, what exactly the body needs, but also have a portion control there a little bit on that.
Right. So we spoke about fitness during pregnancy. Some myths about postnatal, after giving birth, is that mothers can lose weight within a year. Is that true? Can that happen?
Oh, not at all.
Through fitness, of course.
Not at all. I would say fitness is not like a quick relief for your weight loss. Postpartum, I would say, is a bigger phase than the pregnancy and the labor, because you have the responsibility of a child, plus a new mother is being born along with a child, right? So now what happens is, like, the whole shift comes to the baby than the mom, which is again a fact in India today. So now what happens is, like, mothers start to become little underconfident towards their body, including me as well. It has happened with me. So I empathize with the mothers today of the postpartum, sessions, when we do, the higher weight, the belly again popping out, the DR again, urinary incontinence. So DR is basically a diastasis recti, where the abdominal separation happens. Right after the birth, you will get to know about it, because of the prolonged labor sometimes, and because of the wrong way of the postures during pregnancy. So DR again has its own little deeper factors why it has happened. So yeah, talking about the postpartum, I would say you should never expect in the first year that you're going to lose your weight. The first year is more about, like, healthy eating, sleeping again, because the sleep part is lacking because of the frequent breastfeeding, which is still okay. But at the same time, whenever you get a little bit of chance, you try to catch on your sleep. But you should start eating healthy. You should start nourishing your body, because the body has just given birth after 9 long months. Now the body needs to repair back, right? Now repairing is happening through what? The optimal nutrition, what you're going to feed your body. Now again, I would love to say about the grandmothers again, Nushka, what we say, remedies and all. So do listen to them, because again, they have come with an experience of good food also. So we are very lucky in India. I would say we have, like, great nutrition with regards to, like, the dry fruits laddu. There are great recipes, what we say today, right? So we can make use of all these to our body. We should not think that we have to lose weight, so we cannot eat. Of course, you can eat. At the same time, have that how much the body is asking you to eat, and do your regular workouts if possible. How much time, even if it is 20 minutes, 10 minutes also, do your regular workouts, because your body also needs that blood circulation again, needs that emotional change back, right? To feel better about your body, releasing the endorphins, because lack of sleep also leads to what? Cortisol. Now the cortisol is kind of making you groggy, making you grumpy about the whole face as well. And, the shift of the emotional support by different people has shifted to the baby. So of course you feel quite, isolated in that journey as well at times, if you don't have the right support. So I would say, give time to your body, have the right nutrition, but at the same time, do how much the body can do the workout, but be in the regular routine.
Slow and steady wins the race.
Oh, obviously. Not winning the race, because we are not here to win the race, but it is more about, like, just feeling better about yourself in the postpartum, more towards repairing, more towards binding back the core, solving the issues the body is actually, giving you throughout the phase, one by one, not at once, everything. So it will take some time, but you will definitely lose weight, because I have come from a similar background again, like, 16 kgs of weight. But at the same time, my intention was not to lose weight. My intention was always to strengthen it, to repair it. And that comes in a stepwise process. So go slow in terms of building up your strength first, in terms of regaining your core, so that you would have a great time enjoying with your baby as well, right? So it's more about that. and building up your relationship back again with your partner. So this is about the postpartum phase. So yes, you cannot lose weight in a year.
You said sleeping is also important post pregnancy. So they say when the baby sleeps, you need to sleep. Is that at all possible?
Talking from the mother's perspective, definitely not. It's not possible because sometimes we do not get sleep when the baby is getting, because baby's routine sleep cycle is very different from the mother's, right? But what we say is also like catch on your sleep anytime, anywhere, wherever you get some time. And of course, like, you know, it is not that you have to just sleep when the baby sleeps. Rest your body during that time. Even just lying down on the cot or the bed is just giving little rest to the body. Of course, you will not get sleep.
We spoke also about breastfeeding. So does that, I mean, another thing that I keep hearing, I'm not sure if it is smart, but is drinking more milk, does that help with a lot of breast milk supply?
So we are breaking a lot of myths today, I would say. Drinking milk. Okay, so drinking milk is not relatable with the milk you're gonna produce for the baby. It's quite simple to understand. Breastfeeding works in demand and supply process. Like the more you breastfeed, the supply also comes in a similar way, which means the baby has to suck the breast more for the production to happen more, right? Now, coming back to the myth again, like drinking milk can help the body to produce more milk, is totally a myth. Rather, you should focus more on your hydration, good nutrition again. That leads to nourishment of the body and the repairing of the body from inside. And also, most importantly, I would say to the partners who are listening, give a great support to your, the mothers, because they need your touch, the physical touch, the emotional touch. If you start giving that again leads to great, the great breastfeeding process again.
Something that, every mother, every pregnant woman would always be thinking of is the kind of birthing she's going to have, right? So what are the kinds of birthings that are there today? I mean, can you throw some light on that, please?
You mean to say the types of births?
Types of births, yes.
Okay. So the types of birth which are very common in India, what we really learned as well, is vaginal birth, which is called normal delivery.
Right.
And
the only two births I knew were cesarean or normal delivery.
Normal delivery, yes. As in like these are the two births. But again, under the normal delivery, what you say, under the vaginal births, there are two again. Spontaneous again, which is again, the second one is induced. And then, of course, the VBAC, which is vaginal birth after cesarean. That is for the second time mothers, right? So these are again the vaginal births category. Now, talking about the cesarean, again, the cesarean comes into two, which one is elective cesarean, which is again elective, which means it happens during the time, the medical issue has happened. And that's where we try to go through the elective primary cesarean. Now, the second one is also about the emergency cesareans, what we talk about. Now, emergency cesarean is somewhere like, the doctors and the caregivers, wherein they decide right during labor that, the mother has to go ahead with the emergency cesarean because it is unsafe for the baby as well as for the moms. So, yeah, these are the types of births. What
are the things that could make doctors or caregivers know that there is something wrong? I mean, what are those instances?
Well, there are many, in fact, in terms of the emergency cesareans, because even it's not a plan, right? It's more about emergency. So it's not planned. So now when we talk about...
So when you say, you spoke about planned. I mean, planned in the sense the pregnant woman wants cesarean. Is that what you're saying?
Yes, I would say basis on the decision of the couple. Couple of times fear prevails more than the confidence here, and also lack of information. Fear of going through longest labor is also one of the fears today most of the mothers go through, right? So prolonged labor, how would I be able to take that labor pain? Because labor pain speaking about labor pain is always fear. Like the first
Mm.
word is always fear. Would I be able to take? Because that's how we have been, trained, or that's how we have been talked about. So that is one. The second part is also the lack of information, like, on what areas I would be able to go ahead with the vaginal births, or believing in the body more towards, in case if you do not have medical issue, and if you have the caregiver who is more inclined towards the normal births, right, like the vaginal births, one must try to go ahead with the same rather than going ahead with the cesarean. There is nothing wrong with cesarean, because that is also one of the beautiful births, to safeguard the baby, to safeguard the mom's health. But at the same time, what we say and what we advocate today is also about informed cesarean, gentle cesarean, not traumatic cesarean, wherein, like, you have not been informed about your cesarean, and the doctor has kind of taken the pedestal and said, like, let's go ahead with the cesarean, where you have not been informed about why am I going for the C-sec. So you should get informed. You should know what are the reasons I am going ahead with my cesarean. That way it leads to more informed birth. Your your respect is again coming into the picture, where it's more about, like, I know how my birth is going to be. So yes, so these are the two types of births. And talking about, like, where the mothers go through a couple of, I would say, like, where the labor did not progress, which is again one of the most common factors. Labor did not progress, again, which happens due to different criterias again, right? Uterine rupture, again, the wall of the uterus, again, it gets ruptured. That is again very unsafe for the baby. So again, that's an emergency. Placenta previa, lowest, I would say, low-lying placenta. It's like lowest placental position again. So there itself is kind of like, moving towards the plan and the emergency cesareans again. But one must discuss the criterias and the factors with your caregivers. Why should I be going ahead with the cesareans, and why should not I be going ahead with the vaginal births? And that is where we come into the picture, right? Like, as a childbirth educator, when we talk also about the labor and the birth preparation workshops with the couples at Aura, we also educate on the topic, like, these are the criterias you can go ahead with the vaginal births. These are the emergency placements where you have to go ahead with the C-sex. There's nothing wrong with any types of birth, but you should get more information towards why should I go ahead about it, and are you into the picture or not? So you should become more of a decision maker rather than you passing that decision to somebody else.
Somebody else?
The caregivers.
Okay.
So no offense to any fraternity here, but it's more about, like, the couple should become the birth decision makers, because it's their birth, right? For the marriages, we don't give that voice to somebody else. For the births, we should not be giving it, but rather you should be discussing it. It should be more like a discussion and the conversation with your caregivers, rather than just one way out coming from, just the caregiver, or just you telling the caregiver that I need this. No, but if you have medical issues, if you have medical conditions here, even the caregiver would not be able to, help you out. So rather, it should become more like a conversation, more like a connect with your caregiver, with your birth support providers, like, which are us, prenatal fitness educators and childbirth educators. The third one is, of course, the birth boss, which is the mother, and as well as the couple as well.
Nice words, birth boss. Right. Yeah, we spoke about C-sections and the fact that the trend is increasing. But can you throw some light and some statistics on the numbers?
Talking about the, according to WHO, the stats today of the C-section, which is again the cesarean, is 10 to 15% is something where every country, like, has to really respect. But today, India is standing at 21.5, which is again a little bit of alarming figure, I would say. Couple of states are very high in terms of the stats. It is also happening because of the lack of knowledge in terms of opting for the right type of birth, and also to know where I can really opt for the C-section. If the mother is not aware about those contraindications, then obviously she would listen to what it is being passed on to her, right? So, the stats are not so great, but yes, I'm sure things will start to change once the government also helps in terms of, campaigning around like healthy pregnancy, being fed during pregnancy also leads to a lot of, health also for the baby as well. It also benefits the overall labor and the birthing
A
too.
lot of government camps.
Yes, I mean, we should
Initiatives.
definitely have the government camps and the initiatives to talk about the maternal health. Today, it is not widely spoken from the pregnancy phase to the postpartum phase. In case if we talk about it, like we have come a long way in terms of the polio, right? Today, we do not
True.
have that rate. But today, why are we not talking about the pregnancy? Why are we not discussing about the postpartum mums? The phases. Breastfeeding, yes, we do have a lot of campaigns, a lot of initiatives by the government, thanks to them. But at the same time, mothers need help. Mothers need help during pregnancy, during postpartum as well. But I'm sure the government can really do something about it.
Yeah. Is home labor a common concept in birthing?
Okay, home labor sounds.
What is home labor?
So again, like, going back to the generic term about laboring at home, like giving birth at home, right?
Oh, that happens? Have you come across any cases?
Right now, I have not come across any of the cases where the mother has given, the birth at home. But yes, as I said, like, being an educator or being a childbirth educator, you run through the data, you run through the research article. So today, Nagaland, again, like, stands at 94% vaginal birth in India. Now, what is the reason behind is also about the C-section. Again, it has gotten down to 4 to 5% again. So now what it leads to, so the reason behind is lack of privatization, which means lack of private hospitals, right? So now what they do is like, and also the hilly terrains, geographically speaking, the Nagaland, again, it's on hilly area. So to take the commute again, it requires a whole lot of process, a lot of planning, and then it leads to the hospital. Again, the hospitals are not, again, in multiple numbers. Today, it's kind of little lesser there. So now what do they do through their grandmoms, through their moms who are expert again in the births as well? So they try to go ahead with the home birthing again. So I mean, like, a lot of knowledge is being passed. It still happens. It still happens there. The midwives again. So midwifery, again, the culture is more towards like people who had given the babies, help the mothers to give the babies out, right? So these kind of culture is still existing in different parts of India today. The only part is like the lack of facilities again with regards to that is also leading to the vaginal births, and also the safety part also. So we are not also sure on the numbers. What is the mortality of the neonatal part? So we have to see a lot of pros and cons about also the home births. But yes, we do not have like, the full setup where you will have the home births right now. And I would never advise, if you do not have the guidance, if you do not have the expert around you, you should not opt for the home birth, because you do not have the experts. It will lead to, again, the survival of the baby too, right? So you have to really take care of that part. So who are listening, so please don't try home births unless and until if you have the guidance, if you have the experts around, and if you have the caregivers who are into that industry. I have last year, I guess, we have I was reading one article where the couple tried to do the home birth by buying some sterilizing equipment and all, but it did not work out. So it led to the, again, for the death of the baby. So we say, don't try it. Just because YouTube tutorials can help you out, that's not going to help. It is again going to lead you into a very dangerous situation. So please don't try home births at home. Rather than see to your doctor, take the advices, and then go ahead about it. So postpartum is one of the most challenging phases, in a mom's life. So why? Because there was a hormone dip right after the birth, and because of the hormones dip, again the emotions, the thoughts, everything comes into the picture. So at times they feel isolated, they feel quite teary, quite emotional with the phase how they are going through. Most importantly, they feel alone sometimes in this journey. The reason behind, and of course there is nothing wrong, because the whole attention of family, the partner gets shifted to the baby, which is great enough. But at the same time, nobody should forget that a mother is also being born, right? Giving one instance of mine, when I was pregnant, there was this one team member who rightly quoted saying, Shri, you're going on a vacation for 6 months. So,
Wow.
just the free pay. And I was like, really, I'm going on a vacation? As in 6 months of maternity leave? Well, yeah, in India, it's 6 months of maternity leave. But when you say it is enough, I would say 6 months is also kind of less for any mama.